This is Dr. Brown. Now I want to focus or bring your attention how the spine and nervous system are connected. Now the central nervous system is made up of three parts. You have the brain, that's the brain, the spinal cord, which is in the spine, and the spinal nerves. Now the brain sends messages back and forth to every organ, cells, and tissue of your body. Now the nerves are everywhere in the human body. As you look at this diagram right here, nerves are everywhere. Now say for example, during this COVID time, we hear about the central nervous system, the immune system, more than ever. Now the central nervous system controls all the other systems of the body. It controls the digestive system, the respiratory system, circulatory system, right? And the immune system. And these days we hear more about the immune system because of COVID-19. Now, when the immune system is strong, it helps to fight for you. But you know that most people that passed away or died from COVID are those that already have a weakened immune system. They have maybe either diabetes, high blood pressure, pneumonia, and so on. So the immune system is already weak. So here comes COVID, and COVID now just push them over the head in 1 minute. The lungs, maybe how many times for you to breathe in 1 minute. So the information is traveling like this, and then back up for a reply. Let's say when the communication gets right here, there is a blockage. So the information going to the heart and the lungs is being blocked right here. Do you think they would function normal? Not at all. So the heart would malfunction. Some people get high blood pressure, some get low blood pressure. For the lungs, some people get asthma, pneumonia, even malaria. The very first thing most people take when they have any kind of symptoms is what? Medication, right? Painkillers. You know what medications are made for, by the way? Medications are made for symptoms. Know that as soon as you get that, say a headache, a back pain, the diabetes, the high blood pressure, as soon as you take that medication and it takes effect in your system, the symptoms are gone. But when the medication wears off, it comes back. While the cause, right there, is still there getting worse. Did you know that every medication has side effects? All of them. And some of these side effects are deadly. So what we do as chiropractor, we go to the root cause of the condition. You find the cause, fix the cause, and the symptoms go away. There might be a place or time for medication, but medication should not be your first choice. God didn't make a mistake when He made us and forget to put medication in our systems. Wherever those nerves are going, that's where you'll get the symptoms. And this leads to sickness and disease, ultimately early death. So yes, nerve interference, subluxation will kill you. So what we do as chiropractor, like I said, we focus on the central nervous system. You know, many people say they are healthy because they don't have pain. Never do that. That's the worst mistake you can make. There are symptoms in your body or condition in your body that you don't know about because 90% of the nerves don't have pain receptors, so you won't even feel pain. So what you need to do is to do a checkup. Do a checkup. Because if you find something early, you start to correct it before it gets worse. Prevention is better than cure. So now they ask me, so doc, what causes subluxation? Something caused that. Remember in school you learn about what cause and effect. The WHO, that is the World Health Organization, says that over 90% of sickness and disease are lifestyle related. You have slips and falls, you have accidents, you have sports injuries, poor posture, it's how you sit, how you stand, how you sleep. All these cause subluxation, right? On this chart over here, all these are bad posture. Every one of them are bad posture. Let's talk about some of the lifestyle poor habits that you develop over the years. Like for example, so I want to show you the difference. Look at this one and this one. So this is the normal one. This is the one that the discs are worn out. So you have bones now touching and rubbing on each other. And eventually what happened, the bone will fuse over time. So that is one. And then also we go to school, carry heavy bags on our back. You remember those days? And we start school at age 5, 6. And most students carry the bag on one shoulder. So when the bag is on one shoulder, what happened? it pull you to one side. So you see how it's affecting the spine. One shoulder higher than the next one, stand in the wrong posture. In Ghana we call this the akimbo. So always stand with your weight evenly distributed like this. The school bags, here's a picture right there. The school bags here, they have 2 straps. So both straps should be on the shoulder so you're more balanced. And also, when you go bend to pick something from the floor, don't bend from your waist. Bend from your knees. Don't do this. Bend from your knees like this. Sweeping. Some people sweep with that little broom like this, bending from the waist. Use the long handle brooms to sweep, not the long one. Some people wash like this. You know, you can do, raise that bucket higher so you wash standing up like that and take small breaks. Also, another bad habit that you see is sitting posture. What you need to do, right? You see when you sit, do what the normal spine looks like. So if you're looking at it from front or back, it should be straight. Sideways, you should see 3 curves. Here they are, 1 and 2 and 3. So these 3 curves is what we as doctors and scientists call arcs of life. So these are examples here of arcs of life. So even nature, you know, of arcs of life. If you lose any one of these arcs of life, it is not good. It is a subluxation. Like for example, if you look at your X-ray, your MRI, and it curves like this, now the curve is straightened out. So the curve is gone. So the spinal cord, instead of curve, is now stretching. It was not meant to be stretched like that. So that's a subluxation. Or maybe you have bones that are shifted out of place. These are the nerves on both sides. If you have bones shifting left or right, you see how that's affecting the nerve. So that's also a subluxation. Now I want you to look at this chart over here. Now if you have subluxation, say from the neck area, or nerve interference from the neck area, the symptoms that you will experience, some people experience one, some might experience a multiple, some might not even experience any yet. Like from C1, C2 area, headaches, migraine headaches, right? Then you can see the list of them: dizziness, allergies, stiff neck, arm pain, hand, finger numbness, and tingling. You trace that to C4, C5 area. Here's heart condition, high blood pressure. Below the neck, high blood pressure, heart condition. So you trace that to C6, C7, T1. But let's look at the lower spine. Most people have problem with lower back. So subluxation from the lower spine or nerve interference from the lower spine lead to symptoms like constipation, diarrhea, back pain, waist pain, hip pain, numbness, tingling down your leg, difficulty walking, infertility. Nerve goes to the reproductive organs, right? And also low sperm count and weakness in some men. So we as chiropractor, we go to the root cause, find the cause, fix the cause, and the symptoms go away. So we get you back well without medication or surgery. So what you need to do, right? Now, this is an example of the birthing process. Your spine should have been checked from birth and maintained throughout your life. Because the birthing process is stressful on the mom, but you know that the birthing process is also stressful on the baby. Many times we forget about the baby. During the birthing process, when the baby is coming out, the baby head first. After the head is the shoulder. The shoulders are wider than the head. So in order for the midwife to help the mom, so what the midwife do is assist the mom to deliver the baby, helping to save the mom's life. So the midwife hold on to what? The baby's head and neck, there's a picture, and pull and twist and turn. And the birthing process for some mom might take minutes, but for some it can take hours. So just imagine the pulling and the twisting and the turning, easy for a bone to shift. So that's where it started from. So your spine should have been checked from birth. And now, there's a science for correcting subluxation, but we have to find it first. The correction time range between 6 months to 5 years. Now, I'm not saying that's how long it will take you. It will be a gradual process. Some people get results faster than some. Some people see results in days, some might be weeks, some might be months. But even after you see results, it doesn't mean that you should stop. You should continue to correct the subluxation and maintain the correction as well, right? So I want to tell you about one of our members. You see these 2 x-rays here? These are from the neck area. This is the good one. It has a curve, the arc of life. Look at that one. The spaces are gone and the bones are fused. One of our potential members, he had neck pain. He went to this surgery, and what they did after the surgery, they put wires around the bones in the neck area, and it was around 2 weeks after the surgery he passed away. He died. I'm not saying that you'll never need surgery. No. What I'm saying is that some people wait and delay until it's too late. So when you get pain and symptoms, don't ignore it. That's your body telling you that something is wrong. I'm not saying you will never need surgery, but don't wait till you have to do surgery. The surgeon will tell you it's 50-50. I have surgeons that are under my care as well. So make sure that you don't wait for surgery. So there's a science for correcting the subluxation, right? Correction range between 6 months, 5 years. And what we do when you come to our center, the Kumasi Chiropractic and Wellness Center, we put you back on a wellness journey. We correct your misalignment, but we also tell you how to eat well, to sit well. We teach you about these purities of life right here. The pure air, pure water, pure nutrition, pure movement, pure sleep, pure thoughts, and pure power. We make sure that you're sleeping on the right mattress depending on your condition, sitting on the right chair at work. Some people sit on the wrong chair at work. Make sure you're using the right pillow, right? So we give you these information so you create new habits. And this is not going to be an overnight process, because the condition that you're in is not something that just develops overnight. So it's not going to take you overnight to get you back to where you want to be. It will be a gradual process. Now, the doctor's recommendation depends on your condition. Some people are recommended coming for 2 times a week, some 3 times a week, some once a week, and some even more than that. So after the consultation that you do, we'll make a recommendation and then tell you how many times that you need to come in. We also do have office policies at the Kumasi Chiropractic and Wellness Centers, right? And they're all listed here. We go out, we do presentation, because some people have never heard about chiropractic. So what we all listed here, we go out, we do presentation, because some people have never heard about chiropractic. So what we do, we try to create more awareness. So we're on radio, we're on TV, trying to create more awareness, right? Now we have a state-of-the-art technology, a scanning technology, and this is an example of a scan. So what the scan does, right, is scan your entire nervous system. Wherever you have nerve interferences, it shows up on the scan. Even if you have no pain or symptoms, it will show up on the scan. You see colors on the scan. The good nerves are represented by white bars. The rest of them are nerve interferences, subluxation. Green is mild, blue moderate, red is severe, black is even more severe than red. So you take a scan, and I will make my recommendation. I'll translate the scan for you, tell you that this is where you are, no, this is where you need to get to. So I'll make my recommendation based on the findings. So don't delay. Come see us at the Kumasi Chiropractic and Wellness Center to get one of the most important checkups of your entire life, which is a spine and nervous system checkup. The number to call is on the screen there. We are located in Kumasi. So the number, I can go ahead and say 0555-932-339. This is Dr. Brown. Make sure, don't delay. Come get your spine and nervous system checkup so we can put you back on the path to true wellness.